Good afternoon. Hi, my name is Dr. Heather Stanley-Christian, and I'm the founder and medical director of Unity Maternal Fetal Medicine. For those who don't know me, I help pregnant people with complications navigate some tough situations to help them come to their best decisions and their best outcomes um, that is possible. This may be a topic that might trigger some folks who may not have had good outcomes, but I would like to share with you what we mean by a baby or a fetus that's viable. So, a fetus that's viable, it's really the ability of this fetus to survive independent and outside of the uterus. The viability is a technicality because we have the technology and the machines to increase survivability. And that viability can be further broken down into what we call intact survival, which means is the neurologic component of the baby intact, or do you have a fetus that is technically surviving, but there may be a whole bunch of complications? So I just want to state that every premature baby is different. And so what I'm sharing with you is a big generality. However, one size doesn't fit all. Just for the rest, just like everybody, we're all unique, and one size does not fit all. This is an area that's difficult to predict, and you may be in a space or you may have had a history that makes this time of the pregnancy frightening and very uncertain. And so I'm hoping that by having this conversation with you today, that this might give you a little bit of peace and help you to navigate each gestational age and anticipate what viability means in this respect. Now, the gestational age is just one factor. There are other things in the pregnancy that, in the baby specifically, that will contribute to successful survival. Okay. This can include birth weight. That's actually a big factor. Gender of the fetus. It is known that female fetuses tend to be a little hardier than the male fetuses, and that actually might play a role in how we survive generally as a species. If you have one fetus versus multiple fetuses, that is twins or triplets, the singleton fetus it's a little bit more advantageous than the multiple fetuses in the same pregnancy. What occurs during labor, or I should say, what occurs just before the onset of premature labor? For example, if you're having contractions, it's found that you're dilated. Then if there is an opportunity to give the baby steroids for lung maturity and or magnesium sulfate that can protect the brain, those fetuses that have that opportunity to get those medications have a little bit of an advantage over babies who are suddenly delivered without the benefit of those medications. The place of delivery is also very important. We talk about trying to have mother and baby deliver in the same institution rather than having the mother deliver and the baby transferred. That mother-baby dyad, delivering in an institution that can care for a very premature fetus is very important. So those are just some of the factors that come into the equation of maximizing survivability for those babies. Now, the American College of OBGYN, and these are general numbers again, say at 22 weeks or less, survivability is usually pretty low, less than 5%. Once a baby has achieved 23 completed weeks, that survivability may jump up to as high as 30%. 24 weeks is usually when the specialized pediatricians, they're called the neonatologist, they tend to feel comfortable with a 24-week premature baby that is about to join us in the world. The stats are wide ranging, but you may have somewhere between a 42 to 59% survivability. And that number could be as high as 68%. And we're talking about intact survival. Once a baby has completed 25 weeks, that's between 67 to 76 percentile. And usually after 26 weeks, we're in the 86 to high 90s survivability. Now, these numbers, as I said, are not hard and fast. A lot depends on where the babies are. There are hospitals for which they have level 3 neonatal ICUs, and it's really their statistics that drive the survivability. There are some, I'm sure you may have heard, oh, there was a 21 weeker or a 22 weeker that was 1 pound and survived. We're not saying that that's not possible, but likely things being likely, a lot is going to depend on where that 22 weeker is being cared for, and what their success rates are within the neonatal ICU. So I wanted to share that with you because as you're getting to that threshold of viability, perhaps you had a very iffy outcome where, some interventions such as a cerclage may have had to be employed, or, we were kind of praying and crossing everything we have to get you past a certain gestational age. Maybe you didn't understand why the information was being given to you differently at one gestational age versus another. These things that I've shared with you just now are big reasons why. So I want you to take this for what it's worth. But more importantly, if you've had a past trauma or anything like that, I want you to just try and take a deep breath. I cannot begin to even imagine what it might be like as you're living day to day, and trying to manage your past memories with your current situation. It's really not easy at all. See if you can talk to your doctor or provider. If you need to reach out because you're really struggling with it, it's not a nice feeling to live in uncertainty, whether it be this gestational age or other reasons. We here at Unity Maternal Fetal Medicine, we're here for you. And you can catch us at Instagram at Unity MFM. So just use this as a little bit of an education, as a little bit of a background, knowing that it's the data that I shared with you is fluid, and there are a lot more other factors that we have to put in. I would say to you, if you're not sure and you think you're contracting, or you're having a change in your discharge, or you're having any bleeding, please don't wait until your next appointment to share with your doctor. Make a call, and at least have a conversation with somebody over the phone. They should be able to do a triage over the phone to help you determine if you need to come in to be inspected, looking at your cervix, or if you need to be sent to the nearest situation that can, in the nearest hospital that can help you. All right. So I want you to walk good, okay? And I want you to breathe, and I want you to try and find your space with uncertainty that doesn't make your blood pressures high and your cortisol high. And just know that there are people out here that care for you. All right. So walk good, and I'll see you next week. Bye.